Hi, this is Dr. Chan with Crown Dentistry. Today we're going to be talking about just routine dental procedures and why it's important that we see you on a regular basis. So ideally, we like to see our patients a minimum of twice a year, at least to check their teeth, their gums, their soft tissue inside their mouth, and make sure there isn't any cavities or oral cancer. At the same time, we also like to make sure that their teeth are clean. So usually we want to clean our patient's teeth too at the same time. So dental x-rays are very safe. A lot of times our patients will ask why they need them. And the simple answer is that we want to be able to check as much as possible around your gums, your teeth, to make sure that everything is healthy and happy and that nothing is there that shouldn't be there, like an infection or broken teeth. And quite frankly, we can do visual exams and look inside your mouth and take pictures. But the reality is that there are portions of your mouth that we can't see, especially things that are below the gums. So that's where the x-rays come into play. Those x-rays just allow us to get a little glimpse into what's going on underneath your gums. And honestly, sometimes things might look okay on the surface. They might look healthy. But then when we look at x-rays, we find that there's things going on under the surface that we weren't able to detect just by looking in your mouth. So that's why we want to make sure that we see as complete a picture of your mouth as possible. And dental x-rays are a really important part of that. I know some patients are concerned about the amount of radiation that they're receiving when they get x-rays. The great news is that we use digital x-rays here at Crown Dentistry, and those are great because the sensors that we use in digital x-rays are much more sensitive than the old school physical film that was needed by x-rays before the technology of digital x-rays came about. So as a result, the machines that emit the radiation are tuned to be at a much lower level, and you as a patient, you just don't get very much radiation as a result, and that's a great thing. Each dental x-ray produces about 2% of your daily radiation dose that you would get just from walking around in the sun. So it's a very small amount, and in my opinion, it's definitely worth undergoing that just to make sure that your mouth is healthy. So one of the most important things to keep your teeth as cavity and decay free as possible is to have a good diet. That means making sure that you don't either eat or drink too much sugar, and also means that you want to make sure you eat healthy things, making sure that you get plenty of calcium and protein and all the necessary vitamins and minerals that your body needs. It's also really important to keep your teeth healthy. That means brushing a minimum of twice a day for 2 minutes every time, and also flossing at least once a day. And if you're able to do all these things, then you're giving your mouth the best chance to be healthy and cavity-free. So a lot's been talked about with fluoride. We are blessed here in Thomas to have fluoridated water, which means that there is fluoride in our tap water. That's a great thing because our teeth are comprised of a couple of different minerals and elements that make them up. Some of the main elements that make them up are calcium, fluorine, and phosphorus. And basically, we want to think of our teeth as being in a lattice structure, kind of like a grid. And so when we give our teeth these minerals, either by what we eat or what we drink, then we're giving them the best possible chance to stay healthy and strong. Because when we eat and drink, there's bacteria in our mouth that eat the sugar that invariably will be in the foods and drinks that we eat. And when they eat that sugar, they multiply and they grow in number. And then they basically start to produce an acid that is damaging to our teeth. So our body's always trying to repair our teeth in response to this attack. And so the more minerals that are good, like I said, the calcium and the fluorides, the more that we can give it, the better a chance it'll have in order to rebuild our teeth and not allow cavities to form. So there's a lot of different kinds of bacteria in our mouth. Unfortunately, most of them are not healthy. Some of these bacteria cause gum disease. And what that means is that there's bacteria that lives in our mouth both above and below the gums. So we want to make sure that we brush and floss as thoroughly and regularly as possible. And when we're able to do that, we're able to stop this bacteria from flourishing. If we're not able to do that, the bacteria will basically go underneath the gums and start to multiply. And if it stays there long enough without being cleaned out, then it'll start to damage the bone that holds our teeth in our mouth. And this is what gum disease is. So, like I was saying, there's different kinds of bacteria in our mouth. Some of them cause cavities, some of them cause gum disease. And like I said, the gum disease, that's the bacteria that lives underneath our gums and basically attacks the bone that holds our teeth in our mouth. That's why we want to make sure that our teeth are healthy, the bone's healthy, and all the soft tissue covering it, your cheeks, your tongue, your gums are healthy. And if we can do all that, then you'll have a healthy mouth.